Okay, so today we're doing a deep dive on something called health data harmonization.
Uh-huh.
And we've got this really cool visual diagram
Right.
called a conceptual framework for health data harmonization.
Yeah,
You've seen this before.
I have. Yeah. It's a really interesting framework. And really I think very helpful for anyone who is working with lots of different sources of data and trying to figure out
Right.
how to bring it all together.
Yeah, because, I mean, think about all the different data we have about health, right?
Exactly. Yeah.
You've got clinical trials, you've got patient records,
Yep.
even stuff like people's wearables, fitness trackers.
Absolutely. Yeah. All of that is generating just massive amounts of data.
Right.
And the challenge is that it's all in different formats. It's collected in different ways.
Right.
So how do we actually bring it all together in a way that is meaningful and can be used for research and to improve healthcare?
Right, and that's what this is all about. So when we look at this diagram, one of the first things that jumps out are the first two steps, which are collect and document data sets, and then select core data sets to harmonize.
Yes.
And I think that right there is a huge task, just even identifying, like, what are all the data sets out there?
Absolutely. And I think that's something that a lot of people don't necessarily think about.
Right.
They may have their own data set that they're working with,
Right.
but they may not be aware of all the other data that's out there that could be relevant to their research.
Right, so even just that first step is a big undertaking.
It is, yeah. And then documenting them as well.
Right.
So, where did the data come from?
Right.
How was it collected?
Right.
What are the variables that are included in the data?
Right, the limitations.
Exactly.
Right.
All of that is really important to document.
Okay, so then we've got those first two steps. And then the next thing that the diagram calls out is what it calls external view. And it seems like this is kind of where we're starting to look at, like, okay, if we're going to try to combine these data sets,
Right.
we need to kind of zoom out and look at the big picture.
Exactly.
And make sure that it even makes sense to combine them, right?
Right. So I think one of the key things to think about here is study design.
Okay.
So if you have two studies that were designed in very different ways,
Right.
it may not make sense to try to harmonize the data from those two studies.
Okay, can you give me an example of that?
Sure. So let's say you have one study that was done in the United States
Okay.
on heart disease,
Okay.
and then you have another study that was done in Japan on heart disease.
Okay.
But the study in the United States was a randomized controlled trial,
Okay.
and the study in Japan was an observational study.
Okay.
So those two studies are designed very differently,
Right.
and the data that's collected is going to be different.
Right.
So it may not make sense to try to harmonize the data from those two studies.
Okay, so even if they're both looking at the same, like, general topic.
Exactly.
If the studies were done differently,
Yeah,
then the data might not actually be combinable in a way that makes sense.
exactly. Yeah.
Okay. And then, looking back at the diagram, we see a few specific bullet points here under external view,
Uh-huh.
talking about demographics, geography, sample design,
Yeah.
power.
Yes.
I'm assuming all of those things kind of play into that. Right?
Absolutely. Yeah. So demographics are really important to consider
Okay.
because if you have two studies that have very different populations, in terms of their age or their race or ethnicity or their gender,
Right.
then again, it may not make sense to try to harmonize the data.
Okay, so that makes sense. So we've kind of looked at the external view.
Yeah.
So then we move into what this diagram calls the internal view.
Right.
And here we've got metadata similarity and data significance.
Yes.
So tell me a little bit about what metadata is.
Sure. So metadata is basically data about data. So it's information that describes the data.
Okay.
So for example, if you have a data set of patient records,
Right.
the metadata might include information about when the data was collected,
Okay.
how it was collected, what the different variables in the data set mean.
Right.
So all of that is metadata.
Okay, so it's kind of like the background information about the data.
Exactly.
And why is that important for harmonization?
So metadata is really important for harmonization because it helps us to understand how similar or different the data sets are.
Okay.
So if we have two data sets that have very similar metadata,
Right.
it's more likely that we can harmonize the data successfully.
Okay.
If the metadata is very different, it's going to be more challenging.
Okay, that makes sense. And then we see listed here in this diagram under metadata similar and data significance.
Yeah.
It even lists out some different methods.
Yeah.
Coefficients, card index, Gower distance, factor analysis, principal component analysis.
Yeah.
Are those things that our listeners need to know about?
I don't think so, not in detail.
Okay.
But basically, those are all methods that can be used to quantify the similarity between data sets.
Okay.
So they can be used to measure how similar the metadata is,
Okay.
and they can also be used to measure how similar the actual data values are.
Okay.
So there are just different ways of measuring similarity.
Okay, so those are kind of more in the weeds.
Exactly, yeah.
Of how you would actually do the data harmonization.
Exactly.
Okay, so then we get to this box in the diagram called QA/QC.
Yes.
Quality assurance, quality control.
Right.
Why is this important?
So QA/QC is really important because it helps to ensure that the data is accurate and reliable.
Okay.
So even if we've done a good job of selecting the data sets and harmonizing them,
Right.
there's always the possibility that there are errors in the data
Right.
or that there are inconsistencies in the data.
Okay.
So QA/QC is a process of checking the data to make sure that it's as accurate and reliable as possible.
Okay. And are there certain ways that you would go about doing that?
Yeah, there are a lot of different methods that can be used for QA/QC.
Okay.
Some of them are very simple, like just looking at the data and seeing if there are any obvious errors.
Right.
Other methods are more sophisticated and involve using statistical software to identify potential problems.
Okay.
But the basic idea is just to check the data as carefully as possible.
Okay, so it's like a final step to make sure that everything is good to go.
Exactly, yeah.
Okay, so now if we look back at the diagram, we've kind of gone through all the steps of this data harmonization process.
Yep.
And then we get to kind of this last section, which seems to be more about what happens with the data then.
Right.
So you see here, discovery, harmonized data set, public use harmonized data set, city highlight.
Yep.
So what's kind of the goal here?
So the goal here is to make the harmonized data available and usable to researchers and to the public. So once we've gone through all this work to harmonize the data,
Right.
we want to make sure that it's actually used
Right.
so that it can actually have an impact on healthcare.
So it's not enough to just kind of get the data in the right format.
Exactly.
You actually have to make it accessible to people who can use it.
Exactly. Yeah.
Okay. And then this city highlight
Yeah.
thing.
Yeah.
I'm assuming that's just kind of an example
It is,
of
yeah.
how this data could be used.
Exactly. So the idea is that, once you have this harmonized data set,
Mhm.
you can use it to answer all sorts of questions about health.
Okay.
And so the city highlight is just an example of, maybe you're interested in looking at heart disease rates in different cities.
Right.
And so you could use this harmonized data set to compare heart disease rates in different cities
Right.
and see if there are any patterns or trends.
Okay. So it's kind of like, okay, now that we have the data, what can we do with it?
Exactly.
And how can we use it to actually improve people's health?
Exactly, yeah.
Okay, well, this has been super interesting. I think one of the things that I'm taking away from this is just how much work goes into data harmonization.
Yeah, it is a lot of work. But I think it's really important work
Yeah.
because it has the potential to really transform healthcare.
Yeah.
If we can get to a point where we can effectively use all of this data that's being collected,
Right.
we can learn so much about health and disease,
Right.
and we can develop new treatments and interventions that can really improve people's lives.
Yeah. And it seems like this framework that we've been looking at today is a really valuable tool
It is, yeah.
for researchers who are trying to do that work.
Exactly. It gives them a roadmap to follow
Yeah.
so they can make sure they are doing it in a way that is rigorous and that's going to produce reliable results.
Okay, well, great. Anything else you want to add about this before we wrap up?
I think just that, this is an evolving field.
Yep.
So there's always new methods and techniques being developed. But I think the basic principles that are outlined in this framework are really important.
Okay.
And I think they're going to be applicable
Yeah.
for many years to come.
Okay, great. Well, this has been super interesting. Thanks so much for joining me today.
Yeah, thanks for having me. This was fun.
And for our listeners, if you want to learn more about data harmonization, you can find links in the show notes.